I started plowing through all of this data and double-checking source material, it was really alarming that, and as Mrs. Baker said, and when she read, and I had given her a copy of that series from 1993, and she was just almost sadly awestruck, in her words, how little had changed. The lead statistic that I used in the press release when I sent this out is this one. And it's more than 74% of African American under 6 in this city are living and growing up in poverty, and that is indeed a young boy named Antonio who is 5 years old and a kindergartner at Parker School in Madisonville. I've worked a great deal with his mother. She is a graduate of our SOAR program, and she is working really hard to get certification to begin working again as a home health care nurse. So this is not, the next slide is not in the report, but we can all kind of look at, oops, pardon me. We all can kind of cite what the poverty levels are. You know, it's roughly $15,000 for a household of 2, and the standard one that's used is roughly $24,000 for a household of 4 people. So what I asked, and I started researching what it means, and this is brand new research that I've come across, what it means to grow up in poverty. And a study that came out from the University of neuroscientists at the University of Wisconsin, just released in August, it studied the development of the physical brain of children growing up in poverty, putting them at lifelong disadvantage, where the parts of the brain tied to academic performance were 8 to 10% smaller than in children growing up in regular middle-class households, for example. Another piece that doesn't show up on here, that I don't know why we're having trouble with this slide, but Washington University in St. Louis for the last few years has gained a lot of national notoriety in its studies, its neuroscience studies, that show the parts of the brain, and I should write those down, but the parts of the brain that are responsible for development of problem solving and coping with stress and warding off depression. So the mental health piece, those parts, that part of the brain is also negatively affected by poverty. And it's not just the lack of money, it's what comes with the lack of money, which is poor access to health care, lack of preventative health care, environments in low-income housing where apartments are filled with mold and pests, all those types of things. A lot of effort has been talked about in the last few years of food deserts and the lack of access, easy access to quality fruits and vegetables. So the diet is affected by poverty. You know, we're all kind of familiar with this statistic where we have in Hamilton County, infant mortality rate that is 3 times that of white children. And I've done a lot of work in Haiti, and the infant mortality rate in Haiti isn't much worse than it is in Hamilton County for African American children. When we released the book, August 31st, as I mentioned, Eileen Cooper Reed, who many of you know, Eileen is a lawyer and retired president of the school board. She presented her education piece. She wrote a magnificent essay about the school-to-prison pipeline that's in the report. And Eileen, she was talking about the poverty statistic and the effect of poverty on children. And then she had this magnificent line, as only Eileen could deliver. And then they start school. And we wonder, and we're so hypercritical of public schools here and elsewhere when they're working with children that are starting from behind the starting line. So you see this, you have a school system of 33,000 students, 63% are African American, and again, consistent with the statistic of the children under 6, 73% of them are coming from economically disadvantaged households, And you can look there at the high percentage of the children entering kindergarten who are eligible for the federal free or reduced lunch program. And again, this is all, when we put this report together, what I wanted to do was to do everything I could to make it bulletproof. This is data driven. We didn't embellish this. We didn't inflame it. We didn't over present it. It's in some ways, we tried to make it readable, but it's a very academic type of book. And it's not an easy read. And it's not that the authors didn't do a good job, but what we asked them to do was write very academic pieces that are data-driven, that are statistically based, that just present the material the best that it can be presented. Prior to my leaving the Inquirer, I had worked with Dr. Mazaru, the health commissioner. And this is kind of what it all adds up to, life expectancy. And so an African-American male in the city lives on average exactly 10 years less than a white male. And a white woman, it's a little more than 6 years greater than it is for an African-American woman. Again, data-driven. Dr. Mazaru and his people at the health department have collected this data for years. So I'm going to embarrass one of our audience members, Tom Dutton from Miami University. Tom was one of my architecture professors my freshman year at Miami 35 years ago. He looks much better today than I do. But, I told Tom I always felt like I was sprinting just to try to keep up. And after my freshman year, I changed my majors to English and geography. And geography, I found, has become, that background was one of the best decisions I ever made as a young person. And I look at things geographically. I look at space and community. And I think one of the things then you begin to look at in a city that we live in that is so neighborhood oriented and defined by neighborhoods, life expectancy, I work in Avondale. I'm right across the street from the Lincoln statue and from South Avondale School. Life expectancy in Avondale is 68.2 years and the median household income is $17,500. So the question becomes, is poverty an indicator as well of lifespan? An estimated only 49% of people 20 to 24 in Avondale are employed. And even when you break it down more, and this isn't in the report, this is something that I just got really interested in because I'm one of those geeks that loves studying census data. We're in Census Tract 270, which is south of Forest Rockdale Avenue. And that's the area where we're in. It includes South Avondale School and farther south. And so you look at the unemployment rate for people 16 and older, and this is all census estimates, almost 21% for anyone 16 and over, 33% for 16 to 19-year-olds, and then horrifically 70% for 20 to 24-year-olds. And so again, in the National Urban League, and they've given me this language, and because my work at the Inquirer for the last several years, and when I go make a presentation like this, I try to do it without getting too evangelical. But one of the things that our national president, Mark Morial, has said that I've really adopted is, in the Urban League philosophy is we are not saying that families and individuals are not responsible for conduct and behavior and choices that are made. There is an individual and a family responsibility. But yet, on the other side of the equation is the larger society, and we don't have to go back that far to look at centuries of free labor in the South. We don't have to go far to look back at Jim Crow, and we sure frighteningly don't have to look at the efforts to dismantle the Civil Rights Act and the Voting Rights Act, and to weaken that progressive legislation, civil rights legislation of the 60s. There's an assault on all of those things with clever coding, all these types of ways to try to reduce the effort of African Americans and other people who are oppressed economically to vote, gerrymandering of congressional districts, and on and on and on. So what society has, while there's still, and Mark says this, while there's still that individual and family responsibility for people to do their best, there's also a societal responsibility to meet that and to provide opportunity where you don't have 70% people. Trust me, I've spent a lot of time in Avondale even before I went to work at the Urban League, and I walk around, I love to walk, and I walk around Avondale a lot. And the young people and the people, the returning citizens that come to us for our programming, I haven't met one person that doesn't want to work. Not one has said, I want to sit home and get a welfare check. Yesterday morning, I spoke with 4 women that are involved in both our customer service program as well as our SOAR program. And every one of them has worked and been laid off and is trying to get back into the workforce and provide for their family. And you'd be surprised, the other thing you see when you walk around a community like Avondale, and some of my colleagues wonder why I walk a lot. One day a week I treat myself to Subway, and there's only 2 places you can sit down and eat in Avondale. One is the Burger King, and the other is the Subway over by Children's Hospital. I'll walk across Prospect Place, which is right out of our front door. South Avondale School is on the right. And you come up on the crest of the hill and you get this magnificent view back to the east of Walnut Hills High School. And I have met the nicest people, and some days I eat a late lunch because I'm going to work late, and I'll go at about the time South Avondale is getting out, 2:20. And you'd be surprised, and I wish that more white people could be there with me. So I feel like that's why I want to tell this story, and this is right in the census tract. The number of black men who are walking to South Avondale School to pick up their children and walk them home, and holding them by the hands. And I get emotional because I'm so damn sick of all this crap about black